Good morning. Absolutely fantastic to be here. I'm absolutely delighted. I need to let you into a secret before we start, which is that I am one of the 67% of vets who admit to imposter syndrome. The other 33% just don't admit to imposter syndrome, but we all suffer it, and I certainly am feeling it today. Stood in this room of such eminent people with their understandings of antimicrobials and resistance of the same, and also, such a blend of professions. It's absolutely delightful to be here, and thank you for coming to this session. A little bit about my history before I start. I graduated from the Royal Vet College. Anyone in from the Royal Vet College? Come on, just one, two, three. Fantastic, well done. 4. Please take the time during today to have a chat with the vets in the room, because I think we're sometimes a bit of a forgotten group, all right? And I know it's been said about antimicrobial resistance, why should we care about vets? You're not treating people, why should we care about vets? And hopefully those of us in the room will be able to reassure you of why it's important that we're here, why it's important we're taking this seriously. But my career saw me work for 17 years in a mixed practice, but as a farm practitioner. So I've worked with our food-producing animals through all of that time. And the mood of antibiotic usage has really changed over that period. And we're going to come on to that in the presentation this morning, but I thought it was hopefully a useful introduction to where my background is. And where I am now is working for the British Veterinary Association as their junior vice president. So as my children delight in telling me, "You're not a real vet anymore, are you, Daddy?" Which is lovely, and I really appreciate that. But the one plus side of it is my youngest daughter. I walked her to school the other day, and she just stopped dead on the pavement, and she turned to me and she said, "Daddy, you don't stink of cows." So that was a bonus, I suppose, of having come out of clinical practice. So we're going to have a quick run through this and think about what is the role of vets in tackling AMR. And I'm quite a pictorial person, so I apologise, but I want to talk around this slide. My biosecurity message up there, poor Piglet being pushed out into the middle of the lake there. It is important that we all do our part on this, and I think it's somewhere that we've been quite slow to come to the party, and certainly our farmers, I think, have been quite slow to come to the party. One of the most depressing things I was ever told about biosecurity was in 2008, when we'd had a foot and mouth outbreak in the country in 2007, not the major one that I'm sure many of us remember, the kind of piles of burning cows around the country in 2001, but we had a smaller outbreak in 2007. Very sadly, the virus had escaped from Pirbright Laboratory through a drain. It was really quite an embarrassing situation all round and quite devastating for those involved. But we'd just got the country back to being foot and mouth free, and then blue tongue arrived from the continent, blue tongue being a midge-borne disease that affects ruminants. And what I was thoroughly depressed about was I turned up on one of my farms one day, and the farmer said to me, "No sooner had we put all those straw mats full of disinfectant away than the government are telling me I've got to do it again." Well, there's a really kind of damning indictment, isn't it, on our understanding of why we need biosecurity on our farms and what actually it's setting out to achieve. And I do think that we've developed from there. I do think we've made great progress in our understanding of why it's good, and we're starting to understand things about how we trade animals and how we move things around the country and the risks that puts us at. My particular area of interest is TB, and for those of you who don't know the situation with TB, the west and the south of the country in particular has huge problems with that disease, and last year we shot 40,000 cows as a result of it. We're quite keen to reduce the number of cows that we shoot as a result of TB, and one of the things I think we're going to need to begin to do better at is understanding how that disease moves across the country in cows. So we have this crazy situation at the moment where roughly 400,000 animals a year are sold from the West Country over into the east of England because it's much easier to grow the feedstuffs and all the rest of it that we need to finish those animals over in the east of England. And at the same time, an almost exactly equivalent number are sold from the east of England over into the West Country to become dairy animals. And you just think, well, you couldn't design a better system, really, could you, for spreading a disease around the country, which is really hard to diagnose, takes a long time to be disclosed by the tests that are available to us, and there we are, we're just shifting sort of 500,000 animals a year to and fro between the high and low risk zones for that. So, we've got progress to make. But if somebody had talked to me when I was at college about the idea of becoming an antibiotic guardian, it would have been a complete anathema to the way that we were being taught at that time. And I've already mentioned this to one or two people this morning, so I apologise, I do have more than one story. But we developed, in a bedroom as students, we developed this brilliant idea that was going to make our fortune. And it was based on the way we were being taught at that time. And the idea that we had was that we were going to develop a drug called Cornerstone. And I was going to build it in a triangular shaped bottle so that, it was really easily identifiable. And what I was going to put in Cornerstone was going to be a potentiated amoxicillin and some form of Dex, some form of steroid, because I knew that whatever patient I saw, that was going to be the appropriate treatment. That's what I've been taught. And the idea of being an antibiotic guardian at that time was quite a long way from our thinking. So I'm really pleased with where we've got to. And most recently, and I'm going to talk about this a little bit this morning, BVA, and I'm incredibly proud of this, and the team who've put this together at BVA have done a fantastic job. Our One Health in Action report, which we released just last weekend, and there's a special treat for you because I know you'll be delighted by this. I've bought a box of them with me this morning, and I don't intend to take them home because they're really heavy. So please do take that report. It's not just a veterinary report. This is something which has brought together animal health specialists, human health specialists, and environmental health specialists, and looked at how can we collaborate, how do we work together on this issue of One Health in Action. And some of the best case studies I think in there are the ones that have come to us from the dentists. So please take that report home with you. Please have a look through it. I think it's a really, really seminal piece of work. So we have a role, I think, as I say, in food safety. It's not surprising that I think about that as my primary sort of objective, being a farm animal clinician. But also, of course, we're treating individual patients. And, 85% of our profession treat companion animals, treat pets. So BVA ran a Voice of the Profession survey last year and asked them the question, how concerned are you about antimicrobial resistance? And 96% of us are either concerned or very concerned about antimicrobial resistance. And the 47% are those who are very concerned. Okay, that's an increase from the last time we asked that question in 2015. It's rising all the time in the level of concern that we have about it. Can I just ask a question of the IT people? Is it possible to get the speaker's notes version of this talk on my screen here, please? No? Okay, not to worry. That's fine. That's fine. Okay, so there's just some numbers behind here that I struggle to keep in my mind all the time. The joy of being dyslexic, I tell you, it's great. But those numbers do remain in my head because we've, as I say, statistically increased the number of us who are concerned about it. And we're not just concerned about it, we're actually going out there and doing stuff about it. So this is now an annual report for us, the VARS report, which is the Veterinary Antibiotic Resistance and Sales Surveillance Report. We began this roughly 3 years ago, and it's, say, an annual report which looks at antimicrobial sales amongst our production animals, amongst our food-producing animals in the UK. And it's really exciting what we've achieved. So we were set a target when this was first sort of launched in 2013, 2014, and at that point, we were putting 62.5 milligrams per kilogram of active substance into our food-producing animals. We were set the target that by the end of 5 years, so by now, we would have got that down to 50 milligrams per kilogram. And look, we hit that target early. We hit it over 2 years early. I'm absolutely delighted at that. How did we do it? We did it by thinking about alternatives, really, to the blanket treatment that we were currently employing, the metaphylaxis that we were currently employing. And any of you who are in my kind of clinical sessions this afternoon, or late morning, early afternoon, we're going to be talking in there about metaphylactic treatment, something which I don't think impacts on the human sphere as much as it does on the veterinary sphere, and particularly on those herd-level medicine decisions that we're having to make. Some sectors of our profession have made greater changes than others, and the particular kind of standout winners in this have been our poultry sector. They had a long way to go. They started from a very poor base, I think it's fair to say, but they really sort of got the bit between their teeth and made huge reductions to the drugs that they were using. We're going to come on to have a look at where those classes of antibiotics are that we have made most significant reductions in. But one of our big concerns about this was that we were going to see a situation where we would stop using some of the if I can call them more modern drugs, the kind of macrolides, the fluoroquinolones, and start going back to some of the older drugs, the oxytetracyclines, the penicillins, and that might distort our data, because on a kind of mg per kg basis, the dosage of those oxytets and those penicillins is much higher than the macrolides. And you can see that even though we've demonstrated a huge reduction in our critically important antibiotics, down by 19% in 2018, we're still not seeing that bounce, that rebound that we were concerned about across the board. There's one exception, I'm going to come to that shortly. So we've done really, really well. So we'll come on and have a quick look at those classes, and here they are. So I think it's quite important, if I can just highlight as well, this ring at the bottom here where we've got those CIAs, the fluoroquinolones, third and fourth generation KEFs, and the colistin, that we've had to change the scale down there compared to the rest of the antibiotics up above them as well, because they just wouldn't have featured had we gone with those top scales. So they're low and they're getting lower. And there's nothing on there that bucks that trend, is there? Even those older antimicrobials as well. So that's really, really impressive. We set up this scheme a while ago, RUMA, the Responsible Use of Medicines in Agriculture, and it's a brilliant association. It's managed by the NFU, the National Farmers Union, but it receives representation from all areas of our food producing sector across the country. And I now have the joy of going and sitting on their task force, and just to hear the enthusiasm in that room is fantastic. And it's not just vets. We have leaders from the farming sectors in each of those areas as well in the room. And they're very often the ones who are driving these decisions and are driving the improvements in practice that we've seen have allowed us to reduce the amount of antibiotics that we're using, because we face that challenge. You know, we're told by our human health colleagues that we've got a problem with antimicrobial resistance and people are dying of it. And we've just seen, if we go no further, the magnitude of problem that's going to present us with over the next 30 years. So we get the question, so why are we wasting any of this on animals? They're there just to kind of produce meat or be stroked, aren't they, really? So why do we care? Why should we be bothered about them? And I think it's quite a naive view, and hopefully one that isn't reflected in this room. I'm sure it's not, by the kind of self-selected nature of the audience. But food security is a hugely important thing for us in the UK, but more broadly across the world, isn't it? And one of the greatest damages that I think we could do to our environment through food security would be to waste our livestock. One of the reasons I'm so passionate about TB in the UK is the amount of wastage I see going on through the losses in that disease. I'm not going to get into the kind of environmental argument about whether farming livestock is good, bad, or indifferent in a carbon, in a carbon-reducing environment, but it's good. So I won't get into the argument. I'll just tell you that. But it's only good if we do it well, isn't it? It's only good if we actually use these animals and use the products that we derive from them in an efficient and an effective way. And we can only achieve that by making sure that we keep them healthy through their life. So we see some of these things cropping up. We see some of the organic associations, and particularly the American organic associations, now marketing their feed and their other animal derivatives, eggs and milk, as being antibiotic free. I think that's a really dangerous route for us to go down. Two reasons. Firstly, it implies that the other stuff which is on the supermarket shelf is not antibiotic free, and that's absolutely incorrect. We have some very strictly applied minimum residue levels and withhold periods that we know we need to achieve to hit those minimum residue levels within our meat and other derived products. So first of all, everything out there is safe. Let's kind of be really clear about that. But second of all, it's just false. So if you're an organic dairy farmer producing milk in an antibiotic-free environment, you've probably got another herd over there which is producing milk for the normal market. Because what it means is that if your animal has ever received more than 2 doses of antibiotic, she has to move out of that herd and into that herd. It's a completely false way of farming, a completely false way of trying to demonstrate that we're being responsible with our antibiotic use. I think far better for us to go out there and sell the important message that what we're doing is reducing, refining, and replacing our antibiotic usage in such a way that we're generating animals efficiently, effectively, and healthily, and in a sustainable manner. So we set up Targets Task Force. I say the vets and the livestock industry keepers came together to set their specific targets, and that completed last year. And all of those sectors met the sometimes quite ambitious targets that they set themselves. But we're not happy yet. Just seen we're down there to 29.5 mg per kg across our food-producing animals. And we've said, well, what are we going to do next? And so what we've done, I mean, and this is kind of revolution, we've set up Targets Task Force 2. The name took many meetings to come up with. But what Targets Task Force 2 is going to do is say, well, we've achieved what we can achieve, I think, by replacing and refining. What we've got to understand now is what changes do we need to make in terms of our husbandry practices and also in terms of endemic disease levels. So I'm going to mention a disease which I know will be kind of alien to a lot of people here, but a disease called BVD, bovine viral diarrhea virus. And it does what it says on the tin. It generates diarrhea in cows, but it's also immunocompromising. And if you're born persistently infected with BVD, you stand a 1 in 7 chance of actually surviving through to any kind of finished weight or being a productive animal. 6 in 7 of you will kind of just waste and die on the way through. But more damagingly than that, in terms of the cohort of animals around you, you'll just become a little virus factory for however long you are alive. And you'll excrete BVD in your urine, your feces, your sputum, your tears. It'll come off your skin. And you'll just be spreading that around the farm for the whole of the time that you're alive. And there was a brilliant study done. It was done absolutely accidentally, as I think perhaps many of the best studies are, where we're able to demonstrate the impact that that has on growth rates and also on disease levels on a farm. So 10 pens of calves were set up in a shed. And it wasn't a study designed to look at the impact of BVD, but that's what ended up happening because completely inadvertently they brought in one of these persistently infected, one of these PI calves, and by happenstance it ended up in the middle pen. And the outcomes were brilliant. What they were able to show was that the calves that shared a pen with that PI calf just did nothing. They either got pneumonia or they got scours, but basically they did nothing. And the further away you went from that pen towards the outsides of the shed, the less and less that effect became. But we could still demonstrate it right throughout the shed in terms of growth rates, in terms of requirements for treatments for other disease, and ultimately in terms of the carbon footprint and the cost of those animals. BVD is an endemic disease in the UK. Well, I say in the UK, Scotland have led the way really in trying to reduce BVD and are very close to eradicating it. But certainly it's something that as a country we need to pick up on, we need to move forward with. Costs a lot. You know, in the order of billions of pounds in a year, it costs our industry that amount of money, so there's a motivation from that side to look at it as well. But certainly from the point of view of thinking about antibiotics and how do we continue to drive down on their usage, that is just one example of the endemic diseases that we're looking at as a profession and also alongside the farming industry to consider how do we improve what we're doing. So I said that there was one point where the trend had been booked this year and that our usage had gone up. And this is one of the tables from the VARS report 2018. You know, if you're struggling for, I don't know, sleep or whatever, then go online, have a look. No, seriously, it is a worthwhile report. And a lot of it is very pictorial. But you can see right down at the bottom here, the intramammary tubes. And the trend line at the end there pushes it straight back to where it was in 2014 now, in terms of mg per kg being used. And that is the one point where that effect I was talking about of moving to different and older antibiotics has come through and is being seen. We've got these kind of multi-drug tubes that are being used, and they tend to be higher mg per kg than some of the ones that we've moved away from, some of the cephalosporin-based tubes that we've moved away from. And I think that's what's driving that kick at the moment. So what have BVA been doing about it? Well, I've mentioned our One Health report, but you know, we've also been taking this out into our different communities. And to launch Antibiotic Awareness Week next week, I recorded a couple of little videos. I'm can't say I'm too excited about seeing myself in them next week, but they're going to be launched on the BVA website next week. And essentially what we've tried to do with those is to promote to our two different audiences. So using this 7-point plan, we've been trying to promote out to our farmers and our farm clinicians to say these are the things that you can do to try and improve your antibiotic stewardship and reduce the usage on your farms. Because one of the problems that we've recognised in the past is the way we prescribe antibiotics in this country is different to perhaps some of the Scandinavian countries, is that we will have health plans in place which allow first-line treatments to be given out for the duration of that health plan. So a really good example, if we stick with our calves, would be calf pneumonia, and we might say, look, the first-line treatment on your farm for calf pneumonia is drug X. So if you come into my practice, we're not going to sort of seek further sign-off from a vet for the lifetime of this, of this health plan. We're going to say that you can take drug X to treat pneumonia in your calves. The check that we then try and put on that is, hang on a minute, he's only got 50 calves and he seems to have bought 3 boxes of this a week for the last 3 weeks. You know, what's going on here? Let's start to have a think about what's, is this being used appropriately? But the point is we end up with whole bottles rather than just dosages of antibiotics left on our farms. And one of the big challenges that we've found has been trying to discuss with farmers the concept that, it's great actually that drug X treated pneumonia in your calves, but I'm not sure that you should really have then decided it was the best drug to take to treat lameness in your bull. And, we lose control as a profession of those drugs once they're on farm. It's something we've been working very, very hard to take greater control of and raise the awareness of. And this poster, I think, does a fantastic job of doing that. The other side of our market, though, is, of course, our small animal side. And so this is aimed much more at the kind of waiting room in the small animal practice and thinking about asking those questions that I know have been asked in doctors' waiting rooms as well, of let's just make sure, shall we, that if your vet says to you, I don't think you need antibiotics, that you're not questioning that decision. 97% of our members report having pressure put on them by their clients to prescribe antibiotics inappropriately. And, that's a situation that I think we've got to reverse in a client-led way, isn't it? So, asking and saying, don't be alarmed if, as we were just hearing from Diane earlier, we say we're going to go away and do a bit of further testing on this before we decide if antibiotics are the right approach. But also, if we do give you some antibiotics, please use them, that's why we've given you them. We haven't given you them to keep in the cupboard just in case the dog's sick over Christmas and you don't want to pay us an out-of-hours charge. It's there as a course, and so complete the course. And the kind of mantra that we use in there is enough to be effective, but not too much, isn't it? And that's a poster which again has gone around our practices, just this week. I wanted to highlight, if I may, and I apologise for showing a boob on a screen this morning. I mean, I realise it's entirely inappropriate, but hopefully I can get away with it with this audience. But I would like to highlight one of the areas where I've seen significant advance during my career by talking about dry cow therapy. So at the point where I graduated, the mantra really was that we should be treating every quarter on every cow every time we dried her off. Now, for those of you not well versed in agriculture, this happens once a year to a cow. We try and get them to calve on a 365-day basis, and they try and have about 2 months of the year leading up to that calving where they're not milking, where they're not lactating. And so that's a risky period for that udder, particularly the kind of 3 weeks when we first dry her off and all of that mammary tissue is closing down and the teat is beginning to seal itself with its own natural sealants. Really risky time for bugs getting in. And then the 3 weeks close to calving as well, when they're starting to generate more colostrum, more milk in the mammary tissue, and those teats begin to open up again. And it's not uncommon for us to see cows, particularly these very milky breeds, running milk for a few days before they calve. So we've got this open canal for bugs to get in. And also the thing that's evolved over time is the bugs that are causing most mastitis in our cattle. So they were these very infectious bugs. It sounds a stupid comment to make, but we classify mastitis in cows as either infectious or environmental. Infectious being that which can pass from cow to cow, environmental being that which they derive from their environment. And those infectious bugs included a lot of the kind of staphylococcal bugs and strep bugs that responded very well to the old kind of penicillin-style drugs. through management changes, through breeding choices, and through better practice, we've managed to reduce the load of those bugs on our farms to such a point that actually staphylococcal mastitis is not really seen in the same way as it was 20 or 30 years ago. What we see more of, and it's probably to do with cow housing and increasing numbers and increasing stocking densities, are those environmental bugs, and they tend to be more of the kind of E. coli, Klebsiellas, some of the streps as well overlap into that. So we've changed from this situation. We've said, actually, no, this isn't good enough. We're not going to go starting treating every quarter in every cow every time, because actually the evidence out there from National Milk Records, who do monthly mastitis recording for over 50% of our dairy herds, is that we were drying off huge numbers, 80% perhaps of the national herd, who didn't need those antibiotics. They didn't have an infection at the point that we were putting long-lasting antibiotics into their mammary glands. So we had to do something better. And actually what we've ended up with is what we call selective dry cow therapy. So we recognise that we've still got that high-risk period at drying off and at steaming up, to call it, just before calving. And we need to do something to help protect the udder at that time. But that also, putting antibiotics in there isn't necessarily the best thing to do. So we have these teat sealants, internal teat sealants, and we're now able to go down to a quarter level with a cow, by which I mean each of their 4 teats. We're able to go down to a quarter level with each cow and say, is it right that we put an antibiotic into that quarter, or should we just be putting a teat sealant into that quarter? And that's been a tremendous change in terms of what we've done in practice. I think it's perhaps also a reasonable point to mention the change in mindset that the profession has gone through, not just in my career time, but perhaps over the last 30 or 40 years. So the practice I worked for up in Ashbourne, family-run practice, McMurtry and Harding, I worked and I was in partnership with the original Mr. Harding's son, Dan. And Dan would talk to me about being a kid, being at home and hearing Tony Harding and his partner, Mike McMurtry, discussing the financial year ahead. And it would start from a point of saying, well, there's our buying prices for the drugs, so we'll put 100% on that. That's going to be our markup on those. So we'll derive roughly that amount from that. How much do you think we need to make this year, Mike? Oh, that'll do. Well, let's put in a service charge of this then. And that's our financial planning for the year. We're in a slightly different environment now, and I'm very pleased we are. And the environment we're in now is that as a profession, we really don't make a huge amount of money when we're selling drugs. Yes, there's still a markup on them. We're a commercial business, of course we are. But we're not making huge amounts of money on our drugs. What we're doing is actually valuing the professional service that we offer our clients and charging appropriately for that. And it's been that sort of change in mindset which I think has enabled us to do this. So we've talked about reducing, replacing and refining already. I'm not going to dwell on that. New innovation. The only one I wanted to dwell on this slide is Alison at the top there, who has been talking with us as a profession about the ideas of influencing behaviour and influencing change on farm through motivational interviewing. And if any of you have the opportunity to look up Alison Baird's work from Bristol University on motivational interviewing, she's picked a lot of it out of the human medical sphere, but it applies brilliantly to what we do with our farmers as well. And it's based on the idea that when we tell people to do something, they really don't want to do it. I've touched on our One Health report, and I say it stands on these 3 pillars of animal health, human health, and environmental health. And I just wanted to pick out this one aspect from it of antimicrobial resistance and share this is the work that we've been doing. We've been trying to link these 3 together and demonstrate how they're all just part of the same circle, the same process of protecting antibiotics for future use for all of our professions. It'd be remiss of me not to have mentioned the B word at some point during this presentation. And the only thing that I just wanted to touch on here is that we face a huge challenge as we move into whatever the world looks like for us post-Brexit. The Common Agricultural Policy is what's derived over 60% of income for our farms over the time that we've been a member of the European Union. And that's going to go. And we're going to receive subsidies for our farms, hopefully in a different way, but from the UK government. What that's based on and how that gets out to our farmers, I think, will be hugely influential on how well farmers continue to engage with the whole process of antibiotic stewardship, environmental stewardship, and producing high quality, low impact food for us as we move forward into the future. And that's where I would recognise our greatest challenge. Thank you, Diane. I shouldn't photograph my conclusions. I will come to a close though there.